So good evening to everybody, and a few creeping in through the back door I can see. So welcome to, goodness me, it's week 8. It's the final session of the program, and obviously we've covered an enormous amount of information and pointed you out to masses and masses and masses more. So hopefully we haven't swamped you, but I think this week's session is a really valuable one that has great transferability beyond the immediate health librarianship sector to your general understanding and reading of research literature. So I hope you make the most of that. As you can see on the screen, and we sent out messages to you, you do need to have materials to hand. There's the research article, and hopefully everyone's been able to access that. The DOI is there if you need it, and also you can get to it from Blackboard. Then the checklist, there have been a couple of issues relating to that because of firewalls by the sound of it. If you scroll up, if you have not been able to access it, if you scroll up through the chat on your screen, you'll actually see a couple of URLs, one directly to the PDF of the checklist and the other to the home page of the CASP site. So hopefully that will get you all equipped. So the session this evening is going to be run by Suzanne Lewis. She's going to bring her knowledge and experience back into the classroom again, as well as with Lisa Cruzy, who is another significant member of the executive of Health Libraries Australia and has worked with Suzanne in this area for quite a number of years. So we welcome Lisa on board as well. Lisa is with Monash University. So I think Lisa's popping something in to say hello there. Yes, great to be here. Thank you. So let me basically hand over to Suzanne and Lisa for the double act, and we look forward to you supporting us working through all of the things we're going to do this evening. Over to you. There, Suzanne, are you going to step in? Are you all right? Or have we suddenly got a little problem?
Jill, was Suzanne's microphone working earlier?
Yes, it was. We have spoken with Suzanne. Suzanne has spoken with us. So we're just a bit
okay. Just try. Yep. So Suzanne, just try switching it back on again. It looks like it's off now. Okay, now you're muted. So one more click.
Okay. Can you hear me now?
You.
Yes. Okay. I don't know what happened there.
That's all right. But as long as your all systems
all
go
good now.
It's fine.
Oh, phew. Okay.
Panic over.
Okay. Right. Well, welcome back, everybody, and congratulations on making it to week 8. That's a mighty achievement. So well done to everyone. So tonight, this is an overview of what we're going to cover tonight. We're going to talk about critical appraisal, why it's important. We're going to identify some critical appraisal tools, and then Lisa and I are going to run through a practical exercise, critical appraisal of a randomised controlled trial, which was the article that you were asked to have beside you and have a look at before tonight's session. And there'll be a bit of discussion at the end about the assessment task questions as well. So if we think back to week 6, when we talked about the evidence-based practice cycle, we looked at the 5 stages of the evidence-based practice cycle: ask, acquire, appraise, apply, and act. And tonight we're going to focus obviously on that 3rd stage, which is the appraisal stage. So this is where you've asked your well-built clinical question, you've gone off and acquired some research evidence through database searching, and now you want to know whether the articles that you've retrieved are high quality and good enough to base practice on. So what is critical appraisal? Well, critical appraisal is the process of carefully and systematically, and that word systematically is important, examining research to judge its trustworthiness and its value and relevance in a particular context. And as Jill said, it's not a process that's confined to health, but it is very important in health librarianship. But you will learn skills in critical appraisal that you'll be able to carry over into other areas of librarianship and into your own study of librarianship as well. So in the health context, critical appraisal is an essential skill for evidence-based practice because it allows public health professionals and clinicians to find and use research evidence reliably and efficiently to inform their decision-making. Now we have a short video which is an introduction to critical appraisal of evidence, and Cecily, if you wouldn't mind putting the URL in the chat box. This video is produced by the Canadian Partnership Against Cancer, and it talks about the importance of critically appraising evidence that's used to produce clinical guidelines. However, it does outline the general principles of critical appraisal very well, and it's about 4.5 minutes long. And so I suggest that Cecily's just putting the link in the chat box now. Thank you, Cecily. I suggest that if we step away from the session for about 5 minutes and you just quickly watch that video and then come straight back. So that will be at about 6:15. Okay, so we'll do that now. Hello, is everyone back? And can you hear me?
Yes, we can hear you. That's all good. But if you're not back, then they won't hear you.
No, I realised that when I asked the question.
Yeah, everyone's sort of saying, I think most people are back
Okay.
through as well, so that's all right. Okay.
Yeah. All right then. Well, we'll keep going. So there's been a bit of discussion about that short video. Yes, it's certainly worth listening to again. And as somebody commented, it is aimed at people who are preparing guidelines, but the underlying principles of critical appraisal are really the same whether you're appraising a single document for using underpinning practice, or you're appraising multiple documents to prepare a guideline, or multiple documents to prepare a systematic review. Those underlying principles are still the same, and some of those elements that they were talking about in the video around bias, we'll cover those in a little while in this session tonight. So to move on, if we think about week 6, we looked at the evidence-based practice cycle, and we looked at where librarians fit in to that cycle. And we decided, obviously, that librarians are most often involved at the ask and acquire stages of the cycle. But some health librarians are involved in the appraisal stage. Some people do teach critical appraisal skills, and some people are actually, some librarians are actually part of systematic review teams and are involved in the critical appraisal of retrieved studies. And in fact, what I've been doing this afternoon at work was teaching critical appraisal skills to a group of nurses, community nurses, who are doing a advanced wound care course. So in the video, they mentioned different tools, checklists and that sort of thing for conducting critical appraisal. And those tools, there are a number of them out there. They're all really quite similar, and they basically all boil down to asking 3 questions. The first question they ask is the study valid? And that means, is it truthful? Has it been done in such a way as to minimize the likelihood that the results have been affected by bias? And in the video, that was illustrated quite nicely by the target and the arrow that was pushed off course by bias. So that's validity. And the questions in the various checklists around validity all focus on the methodology section of research articles. The second question in the critical appraisal checklists is around results, and asks what are the results. And this includes not just what they were, but have they been subjected to statistical analysis. And this is important for study types such as randomized controlled trials, because the statistical analysis is used to minimize the likelihood that the results are due to chance rather than to an actual real effect. And then the third question is a question around, are the results useful to my patient? And this means thinking about whether the study population is close enough to the clinician's patient population to make the results transferable. So what we're going to do is run through a process of critical appraisal to see how it works in practice. And we're going to go back to this clinical scenario which we looked at in week 6. And this is the one about the librarian working in a regional hospital, and a physiotherapist comes to the librarian and asks them to find a couple of highly relevant articles on the use of virtual reality to improve balance in elderly people who are being discharged from hospital after having a fall. So currently the health service offers an outpatient falls clinic to patients who are at risk of falls, and the physiotherapist is wondering whether virtual reality games or programs would be an effective addition. So we would, as librarians, we would do a reference interview with the physiotherapist, and we would try to break the question down using the PICO acronym, which we looked at in week 6. And if we think about the question and break it down into the PICO elements, we can see that our patient population would probably be something like adults 65 years or older with poor balance and a history of falls. Our intervention would be the virtual reality system plus usual falls prevention treatment. The comparison would be usual treatment only. And the outcomes would be things like a reduced number of falls and a decreased fear of falling. And just to recap the PICO acronym, the intervention is basically anything that's done to the patient with the aim of treating or preventing disease. So it's any form of treatment or therapy. And most commonly it's a drug therapy like the pink and purple polka dot pills. But it can also be diet therapy, physical therapy, entry into a program, an educational intervention, anything like that. And in this case, the virtual reality treatment falls into probably that sort of physical therapy or entry into a program kind of intervention. The outcomes are the factors that are measured to estimate whether the intervention has had any effect. So these are the factors that are expected to change due to the intervention. And for our patient population, we're looking at reducing the number of falls, decreasing their fear of falling, maybe decreasing their likelihood of readmission to hospital for a fall, those kinds of things. And because this is a question about therapy, the best kind of research to answer the question would be a randomized controlled trial or a systematic review. So they would be the kinds of articles, research articles that we'd be looking for in a search. So I did a quick PubMed search. The physiotherapist only wanted a few highly relevant articles. They're not about to embark on a systematic review, so a PubMed search to start with would be probably quite appropriate. And I'd used the search string virtual reality and falls and elderly, and I popped that into PubMed and I got 29 results, most of which appeared relevant. And because I know Cheryl Hamill and I know the importance of checking the PubMed query translation table, I did that to make sure that PubMed had taken my query and translated it appropriately. And just by looking at that table, I found that it had, although there was one slightly weird thing with the term virtual reality where it seemed to be looking at a journal title called Virtual Real. I don't really know what that was doing there, but it didn't seem to affect my results, so I was pretty happy with the results. I also, I I also did a quick search in the Cochrane Library, and I used the same search string, virtual reality and falls and elderly, and I just got 4 results from the Register of Controlled Trials, no systematic reviews. And if I took elderly off, I got 3 results, which were all trials. However, I did try changing the search query to virtual reality and balance, and I did get 2 Cochrane reviews and also 2 references to another review. And just looking back at our evidence hierarchy, we can see that so the 2 Cochrane reviews, they would be sitting at the middle level of the pyramid on the left. There's syntheses, and they would be a higher level of evidence in that pre-appraised research pyramid. And then the randomised controlled trials that I identified in my PubMed search, they would be sitting at the top of the pyramid of primary original research. So for the purposes of tonight, the study that I chose to appraise is this one by Duke and others, Effects of Balance Training Using a Virtual Reality System in Older Fallers, because, for a number of reasons. First of all, it was relevant to our question, and secondly, it was an open access article published fairly recently, 2013, and it's also an Australian study. So I thought it ticked a few boxes in relation to our question. And the checklist that we're going to use tonight is one of the CASP checklists, the Critical Appraisal Skills Program checklists. And as the brief video said, the checklists are just really, really helpful because they focus on the methodology of the research and the results. They remind you of the important things to look at, and they allow you to make a judgment about whether the article contains evidence which is valid, reliable and applicable to your clinical question. And these CASP checklists are free to download from the site, and that's just a screenshot of the site, and you can see that there are checklists for each for different kinds of study types. Now, I think we'll probably keep going at this point. It's probably a bit early for a break. So now I'd like to introduce my colleague, Lisa Cruzy. So Lisa is manager of the Hargrave Andrews Library at Monash University, and she's also co-convener of the Australian Evidence-Based Practice Librarians Institute. And we're going to discuss the article using the CASP checklist. But before we start, I'm just going to ask Lisa to say a few words about the Institute.
Good evening, everyone. It's lovely to join you tonight. And it gives me great pleasure to just talk about the Australian Evidence-Based Practice Librarians Institute, because we're up to the 6th year of the Institute, and it originally, we first started it in 2011, and we had Connie Shard, who was and still is, the key director of the Institute, and the Australian Institute was really developed, and it evolved from her Evidence-Based Medicine for the Medical Librarian, which is another online 8-week program, and it still continues until this day. But basically there was a lot of interest in her program, and she contacted me about potentially having a 1-week residential program based in Australia, and we did the first one in Brisbane, and Suzanne Lewis was one of the very first tutors, and she's continued, and she's presented at every one of our 6 events. And
it's a 1 week. Well, generally it's has been in the past around 3 days. This year it will be 4 days, and it's a live-in event, so we get a lot of value from the participants. We limit the number to 24 participants, and we have 6 tutors, 2 of which will be from the US this year, and 4 will be Australian tutors from either hospital libraries or university academic libraries. And we do cover critical appraisal, which we're covering tonight, but we cover all aspects of the fundamentals of evidence-based practice. And in fact, if you do Google even the acronym for the Australian Evidence-Based Practice Librarians Institute 2016, you'll find a library guide with the full program for the event coming up, which will be the first week of December for 2016, and it's being held in Adelaide, hosted by Flinders University, and you'll see the full program if you are interested. And probably in a couple of weeks' time there'll be a notice going out on the ALIA Health Libraries list with details and indicating if there's still availability for anybody interested in attending this year's institute. But it should be another worthwhile event. We get wonderful feedback from our participants whom we survey at the end of every institute week, and the feedback has been excellent. So encourage everyone to continue their health librarianship studies and come and attend one of our institutes one day. Would you like to?
Thank you, Lisa.
Yeah.
No, I think you've pretty much covered it. Yes, we'll the registrations have been offered firstly to people who put their names down on a EOI list, and then will be open up more generally in the next week or so. But if there's any of our special students listening tonight who want to attend, I'm sure that if you email myself or Lisa, we might be able to get you in a bit early, maybe.
Yes. In fact, there is a registration form on the Institute Library Guide for those who are really keen, can go in and find all the details about the event there. In fact, I can put the
Okay, so... Oh, thanks, Lisa.
No problem. Okay.
So we're going to now work our way through the CASP checklist for RCTs, and this is a bit of a taster of the kind of thing we do at the Institute. And for those of you who have it in front of you, which I hope is all of you, you'll see that the checklist is divided into 3 sections, 11 questions in 3 sections. And the first section is asking about the validity of the trial, the second question about the results, and the third question about can they be applied locally. And the first 2 questions are screening questions to help you decide whether or not to read further. So the first question is, did the trial address a clearly focused issue? And Lisa, what did you think about this question?
I found in the abstract that it indicated the aim of the study, which was to evaluate the effect of a new virtual reality system, which is the Balance Rehabilitation Unit, on balance falls and fear of falling in a population of community-dwelling older subjects with a known history of falls. So I'd have to say yes, that the trial did address a clearly focused issue, and that is, as I've mentioned, stated in the abstract, which many of you probably noticed. Though
yes.
Yeah, it doesn't actually, though, whilst it gives a little bit of context, it doesn't really then, it doesn't basically provide details on the literature review. It just really refers to some research in the introduction. So I don't think we could say there has been a comprehensive literature review. But it certainly did address a clearly focused question.
Yes, I'd have to agree with you, Lisa, and I think you can really get that from the abstract first off. Now, the second question, the second CASP question, is about randomisation. Was the assignment of patients to the treatments randomised? And before we answer that question, I'll just talk a little bit about what randomisation, why it's so important in randomised controlled trials. So randomisation is the process of how patients who are enrolled in the trial are assigned to each group, to the intervention group or the control group. And it can be done in a number of ways. Most commonly these days, a remote telephone randomisation service is used, where the researchers can ring the service and they can receive an allocation for the patient. But the most important thing about randomisation is that it cannot be predictable. So each patient who enters the trial should have an equal chance of going into either group, and no one should be able to know ahead of time which group the patient will go into. So doing something like assigning patients via their date of birth or their hospital admission number or consecutively, such as A, B, A, B, A, B, none of those methods are true randomisation. And randomisation is so important because, statistically speaking, it balances those two groups of patients for known factors that might influence the outcome. So for our question, that might be things like age, comorbidities, which is the number of existing diseases that they have. Dementia maybe might be another factor. But randomisation also balances the two groups for unknown factors, things that the researchers don't necessarily know are going to affect the outcome. And these are factors that are known as confounders. And the randomisation is the strength of this particular research methodology, and that's why these kinds of studies are at the top of the pyramid of primary research methodologies. So, Lisa, how did you answer that question about randomisation?
Well, if we look on page 258, it indicates that subjects were randomly assigned, but we're not actually told how the randomisation was done. So it does indicate subjects were randomly assigned to either the balanced rehabilitation unit, training or control group. I mean, generally the best research usually states how the randomisation was done, so the reader can then be sure it's been done properly in the ways that Suzanne's just explained. So it has been done, but we're not sure how in this case. So I guess if we're looking at the CASP form, we would now probably stop and say, is it worth continuing? Well, I suppose, in this case, we know that there's not that much content on this topic. I think there's just over the 35 results. And I guess I'm particularly interested in this study. It's a randomised controlled trial, and it's an Australian study. And so as Suzanne pointed out earlier, it does tick a lot of boxes. So yes, I think it's worth continuing.
Okay, let's do that.
Right.
So then if we move on, whoops, to question 3, and I think we might have just missed we've just missed one slide here, but that's okay. Question 3 is about blinding, and the question asks, were patients, health workers and study personnel blind to treatment? And this slide just shows the 3 main groups of patients, of people who need to be, or who should be blinded, ideally in a randomized controlled trial. So the first group obviously is the patients, and the patients should be blinded if possible to avoid a kind of measurement bias. Because if the patients know which group they're in, if they know, for example, that they're in the intervention,
We've just lost your voice again. I'm not quite sure.
Suzanne, we've just lost your audio. Can I get you to try toggling your microphone on? And are you able to hear me? I'm just wondering if Suzanne has had an internet dropout and that's what the issue is.
I can I'll give her a couple of minutes.
Lisa, if you could continue, that would be awesome.
Sure. Okay. So I'm aware, if we look on page 262 of the paper, that the patients and the health workers were not actually blinded in this study. And given the nature of this study, it's really not possible to disguise from the patients and study personnel who are providing the treatment what, the treatment they're actually, or the patients are receiving. I mean, it's unlike when you are administering a placebo drug, and it's certainly much easier if you've got an opaque envelope to, drugs can look similar, but in this case, the treatment cannot really look differently. So in this case, and that's why blinding is not always possible in much of the nursing and allied health research, and that's why there's fewer randomised controlled trials in this area than there is in medicine. Okay, so moving on whilst we see if we can get Suzanne.
So we're just trying to check whether she is, but we're just trying to check her connectivity, if you like. And I'll just...
Okay, she's typing.
Just to check.
I'm back, but with no microphone.
No mic. Okay. Kate is typing. Sorry about this, everybody. It's all been so stable for a while. It's not been good.
Okay, Suzanne, I've just made you a moderator, so you should have a...
Okay, I just turned it on. Can you hear me?
Yes, we can.
Oh,
yes,
good.
you're back.
Ah,
All good.
I'm
well done.
really sorry. I don't know what
about that.
happened then. It all just kind of went grey.
And Stephen Chang's come up with a question. Great to have you back, Suzanne, though. Oh, is she back?
Yes, I'm back. Yeah. So where did you get up to, Lisa?
Excellent. We're up to question 4, but we have, I've noticed Stephen has a question on, you know, that we've raised that we have partial no to questions 2 and 3, but we are continuing. And I guess my justification for continuing is the nature of this study being a randomised controlled trial and being in the Australian environment. I'm still curious, and I do want to pursue the study a bit further. I think it's still got merit in continuing. What would you say, Suzanne?
I would agree with you, Lisa. The question of blinding is difficult for a lot of nursing and allied health research, which is where this study sits, because it's really difficult and often impossible to blind interventions like the virtual reality system. You know, you can't really, you know, the patients know what they're doing, and the people administering the therapy know what's happening, and it's just not possible to blind them. And I think in terms of the rigour of nursing and allied health research, it's still worth doing randomised controlled trials and just accepting the limitations of the kind of intervention that you're studying, but trying to be rigorous in the area, pardon me, in the areas that you can control. So I would say let's continue on. Yes, Stephen, yes. So, you know, even though we've said no to the blinding, yes, there's obviously a good reason why it hasn't been done, because it's not possible, so we could still continue. So moving on to question 4. So this question asks, were the groups similar at the start of the trial? And this is important because the researchers want their 2 groups to be as similar as possible at the start of the trial with respect to all the variables that could possibly influence the outcome of the trial. So ideally, the only difference between the 2 groups should be the treatment that they receive. And the baseline characteristics are usual variables such as age and gender, and then there would be variables specific to the question being studied and the outcomes being measured. So for our group, it was things like number of falls in the last year, vitamin D levels, and so on. So Lisa, what did you think? Did you think that the groups were similar at the start of the trial?
Sure. Looking at the baseline characteristics in Table 1 on page 261, even if you just glance down the 2 lots of columns, and you can see that certainly the baseline characteristics of the intervention and the control group are really fairly similar. So, yeah, we do have that seems to be pretty good data there, and well documented.
Yeah,
quite similar.
I'd agree with that.
You can see the age group and gender. Yep.
Yeah. Okay, so we can answer yes to question 4, and we can move on to question 5. Now, this question focuses on what happens to the patients in the trial, and it asks, aside from the experimental intervention, were the 2 groups treated equally? So ideally, you have two groups of patients, and the only difference in their treatment should be whether they receive the intervention or the control, and all other things should be the same. So, Lisa, what did you think for question 5?
So, the two groups were generally treated similarly. So we're looking at page 259 and descriptions of the Balance Rehabilitation Unit training protocol and usual care. And then we also on page 260, there's month 9 reported results. But I have found there's one difference, and that's the intervention group received additional assessments at 6 weeks, which the control group didn't receive. So, you know, you have to ask, would this have affected the results?
Yes, it's hard to know.
And
it probably wouldn't, but there is the factor that the more attention patients receive, the more visits they have with a health professional, that itself can influence the results, even if it's not actually physically changing anything. There have been studies that have shown that you know, if patients get a lot of attention, they will actually do better than patients who get less attention. So,
breaking up a little bit, Suzanne.
beg your pardon? Okay, so we'll move on to question 6. Now, this question asks, were all of the patients who entered the trial properly accounted for at its conclusion? Now, this is important because statistically speaking, it preserves the randomization. So all the patients who started the trial should be accounted for at the end of the trial. Now, this doesn't mean that they all finish the trial. In fact, in nearly all randomized controlled trials, some patients will not complete it. Some patients may swap groups, some may be lost to follow-up because they move away or whatever. Some patients may die. So this doesn't mean that they just get forgotten about, though. The researchers should make strenuous efforts to follow up these patients, and sometimes their results will be included in the analysis even if they're only partial results. And the biostatisticians will make adjustments and will run various analyses with and without incomplete data to see if they make any changes to the results. But the most important thing is to identify whether there's any difference between the two groups regarding the patients who drop out. So, you know, do you get a lot more dropouts from one group rather than another group? So, Lisa, what did you think in response to question 6?
Okay, it's actually a little bit hard to tell. So if I look at page 260 and we look at adherence, so there was 2 out of 30 subjects in the virtual reality group actually withdrew before the end of the 6-week training period. But we're told, we're not told whether any of the 30 subjects in the control group withdrew or were lost to follow up. So really best practice, as we know, is that all subjects should be accounted for whether they withdraw or they swap groups and etc. And basically good articles will provide a flowchart that show the numbers lost along the way and the numbers completing the intervention and control therapies.
Right, thanks Lisa. Yes, I definitely agree with that. We just need a little bit more information to be confident to answer that question. Okay, so those are the questions about methodology that allow us to make a judgment about the validity of the study. The next couple of questions are about the results of the study. So question 7 asks, how large was the treatment effect? Which, in other words, was a difference identified between the two groups, and if so, how large was the difference? What did you think, Lisa?
Okay, so the difference in several outcomes measured in the intervention and control groups was statistically significant. So once again, if you have the paper on page 261, we can see the discussion, and it indicates consideration of the, I suppose, as we're working through this process, need to take into consideration that the numbers, the actual numbers, are really beyond the scope of this course. So we're not to get stressed by having to interpret the numbers, but the main thing to look for is really the results for each major outcome and ensure that they're each reported, and that there's been a difference between the intervention and the control groups, and whether it's statistically significant. And in this study, the researchers did find statistical significance between the two groups in the limits of stability, the centre of pressure, the incidence of falls and the fear of falling. So the difference favoured the intervention group, which was the virtual reality group, and the results are presented in some graphs on page 262, but I find these graphs extremely small and difficult to interpret, but they are discussed, throughout the article, and the important part is the intervention, was found to be statistically significant. So that makes, the article quite interesting.
Yes, thanks, Lisa. I'd agree with you about those graphs. I think that the results themselves are interesting, but they're quite poorly reported and difficult to read in this article. So in the CASP checklist, question 8 asks about how precise was the estimate of the treatment effect. Now, this question is beyond the scope of this course, and when you do your assessment task, you don't need to answer this question in your assessment task, so don't get too stressed about it. But I'll just say, on general principles, with randomised controlled trials, the smaller the range of results, the greater the validity of the study. So precision is referring to the range of possible results that were obtained. And the other thing to remember with randomised controlled trials is that the larger the number of subjects, the smaller the range of results is likely to be. And this is a small study, it's only got 60 subjects. So it may well be considered like a precursor to a larger study. Okay, and then moving on to question 9. Questions 9, 10 and 11 are about applying the results to the clinician's own context, to the local population. So the results of one trial on one group of patients are not necessarily transferable to another group of patients, and this is where clinical expertise and experience comes in. Lisa, what did you think in answer to question 9?
Okay, well, as we can tell from the affiliation of the authors that this study was undertaken at the Falls and Fractures Clinic at Nepean Hospital in Penrith, Sydney, Australia. And that's partly why I was interested in pursuing this study, because the population is similar to my population, or the population of the physiotherapist asking the question. But one thing that's interesting to note on page 258 is the exclusion criteria, which is any severe visual impairment, the inability to walk independently with a cane or a walker, inability to stand unaided for 60 seconds, a score of less than 22 in the mini mental examination indicating dementia, Parkinson's disease or any neuromuscular conditions, geriatric depression scale less than 8, and inability to understand or answer study questionnaires. So if we're applying all of these criteria, we might exclude everybody in our clinical scenario. So in other words, after applying those criteria, who is left within the group of people are likely to be those that are pretty healthy and don't necessarily represent the population of the elderly fallers.
Yes, I think that's a very good point, Lisa. That's a pretty comprehensive exclusion list, and in the real world, the population of elderly fallers is quite likely to have some of those sort of existing impairments or morbidities. So that's a bit of a question mark, I guess, over over this study. Okay, so moving on to question 10. So Jill's just posted a question. What about the ethics committee which gave approval? What do they consider in that area? That's a good question, and I think certainly for some of those exclusion criteria, they may have been applied in order to meet ethics committee recommendations. So usually researchers are not allowed to recruit people to their study if they have a condition such as dementia or something else that means that they're unable to understand or answer questions, they're unable to understand or complete the therapy that's being offered and that sort of thing. So yes, you're absolutely right. Some of those exclusions might be due to ethical reasons as well. Okay, so question 10 of the CASP checklist asks, were all the clinically important outcomes considered? And in other words, did the researchers leave anything out? And this is a judgment call that's made by clinicians, but I think on reading this article we can be pretty confident that all the clinically important and relevant outcomes were considered, and descriptions of those are given in the methods section. But you would certainly, as a librarian, you would want to be checking that question with a clinician with expertise in that area. And then the final question, question 11, is about benefits, harms and costs. And Lisa, what did you think for question 11?
I think it's, once again, it's another one that's a judgment call by clinicians, and an economic analysis is also beyond really the scope of this article. So the librarian in this situation possibly could be asked to do a literature search for economic evaluations of the BRU technology as part of a health technology application assessment. So the main thing look for in this article are any reports of harm or unwanted side effects, and really compliance with the intervention. You know, in terms of 97% adherence to the training program, which I guess is also covered on page 260 here. So yeah, once again, it's it appears that there has been, you know, pretty strong adherence to the training program, and you know, we don't really have any side effects being reported. So
yeah, and that's really important.
You know, yes.
Okay, so that's just one example of using a checklist to critically appraise an article, and you know, I think it's very helpful to use the checklist. It reminds you of all the things to look for. I think overall this article is pretty good for all the reasons that we've mentioned, and as Lisa said, it's there wasn't a lot of literature available in the field, and it is Australian, which is also really helpful. So thank you very much, Lisa. Have you got any final comments to add on the article?
No, I suppose it's really just on the process that it's just practice, and you know, it's just building up that experience of working through the checklist and having a go, and it's really been fun to work with you tonight, Suzanne, on going through the checklist for this particular article. So thank you. Thanks, everyone.
Thanks very much, Lisa.
Yeah, no, thanks. Yeah, and as you talk about the process there and the fact that you've actually done it as a dialogue, I'd really encourage the participants to take that approach as well. So rather than just sort of mulling over things and trying to work things out independently, very often by sort of talking it through with somebody and their eyes and their interpretation of the information as well can actually be quite a powerful approach to do. So don't feel that you've got to sit in isolation. If you are working with a mentor, you could sort of talk with them about different things, or just pair up with your colleagues or other people at work and sort of develop those skills, as I say, not in isolation, but doing it as sort of a double act, so to speak. So, but that's just my take. I think it's a good way to explore it.
Sure, Jill, and just lastly, that's a great comment, because it's often a journal club that will appraise articles, and you know, it really then involves the input, or achieves the input from so many different experts, and the librarian as well can contribute quite a lot. So it's an excellent point. So I'll hand back to Suzanne.
Thank you, Lisa. And Cecily's just also made a comment there. When immersed in critical appraisal, it's easy to see holes in many published trials. Can be discouraging. Yes, that's absolutely right, Cecily. And you know, when you're doing critical appraisal, it does point you to some of the shortcomings of published research. But I guess I also sort of think it's important to keep in mind that particularly a piece of research like this one that we've looked at tonight, it's real world research done with real patients in real clinical settings, and in that sort of scenario, it's impossible to achieve perfection. So, you know, if you're a researcher working in a lab with some rats, you've got control over, you know, a lot of the variables that can impact your research. Whereas once you get out into hospitals and working with patients, you're really subject to a whole lot of variables that maybe you can't control so much. So that's just worth keeping in mind as well. So now, yes, and Cecily's yes, perfection isn't possible. That's absolutely true. Now, Jill, we've got not all that many slides to go. Do you want to have a break now, or do you want to keep going and finish a bit early?
I'd say just because it's been quite intensive, let's just take a very short break, just sort of 5 minutes or so, and then come back, because there's a bit of discussion around, you know, what's relevant to the participants in the course from here. So it won't take very long, but I think just a little bit of a break would be good for everybody, just to go and stretch and then come back with a fresh mind, if that's all right. So it's 10 past now. Just make it a 5-minute break. So back at 15:15 or 16 past. Okay, we'll see you very shortly. But thanks very much, Lisa and Suzanne. Right, we've had a little bit of a break. I needed a stretch. I haven't got the best chair here. I'm sort of in my daughter's study area and it's not the best. Anyway, back we are, and we're going to still have a few more words from Suzanne. She's going to sort of give us a little bit of information around, as you can see on the screen at the moment, the role of the evidence summary. And again, that's not limited to medicine at all. You'll find that in many other areas there of disciplines there are evidence summaries, and it's something that you can get involved in, even to do a review of research across the library and information practice arena as well. So, but Suzanne, do you want to lead us through a few ideas here, please?
Yes, thank you, Jill. Okay, so having critically appraised an article, whether it's on your own or, as Jill and Lisa said, in a group and perhaps in a journal club, for instance, you might want to write up your findings in the form of an evidence summary. And certainly in the health world, these are also known as CATs, or critically appraised topics, or clinical knowledge summaries, or clinical evidence summaries, and so on and so forth. And what an evidence summary does is it summarises a piece of research plus offers some critical appraisal of the research as well. So you can find evidence summaries published in journals in the health field, journals such as evidence-based medicine, evidence-based nursing, and so on. They're also done on a broader level by organisations such as the Joanna Briggs Institute, which we looked at very briefly at the beginning of last week, and the journals, as I said, and there's also in the Cochrane collaboration, if you think back to week 6, there is a journal club there that has some evidence summaries. So they can be found in a lot of different places. And the aim of publishing evidence summaries is to make life easier for busy clinicians by alerting them to new and important studies in their field and providing the summary and the critical appraisal of the research so that the clinician doesn't have to go back to the original article. So for our topic on virtual reality and balance, which was a topic in the field of physiotherapy, I had a quick look in a database called Pedro. Now, Pedro is a free open access database, and it's based in the University of Sydney. And it's basically a database of evidence summaries of studies that are relevant to physiotherapy. And when I searched it, I found a number of systematic reviews that were listed on the topic of virtual reality and balance. And you can see in that screenshot, you can see them listed there. The fact that they haven't got a score next to them, where it says score something out of 10, not applicable, that usually means that the critical appraisal hasn't been done yet. But this next slide is still from Pedro, and it's the evidence summary for not a systematic review but an individual randomised controlled trial of virtual reality-based exercise to improve balance in patients after stroke. And I just wanted to put it up so that you could see what it looked like, so that you can see just before the citation, just under the citation, there's a quality score, 8 out of 10. And then next to that, you can see the elements that the reviewers looked at to arrive at that score. So you can see eligibility criteria, yes. Random allocation, yes. Concealed allocation, yes. Baseline comparability, yes, blind subjects, no, and so on and so forth. So those elements are very similar to the ones that we just looked at in our critical appraisal exercise using the CASP checklist. So you can see it's the same sorts of questions that are being asked regardless of the tool that's used for doing critical appraisal and producing an evidence summary. So do check out that Pedro database if you get a chance. Now, as Jill said, evidence summaries are also published in the Library and Information Science field, and I'm sure some of you have already seen this, but one excellent source of evidence summaries is the Evidence-Based Library and Information Practice Journal. Now, this is an open access journal which is published 4 times a year, and each issue contains between 8 and 10 evidence summaries of published research, and these can be both new research and sometimes they'll do evidence summaries on classic studies as well. And it also is well worth looking at and getting a table of contents alert for each new issue. And it's a great way to keep up with the literature in the Library and Information Science field. One other resource to draw your attention to, and this is the Health Libraries Australia Journal Club. So the Health Libraries Australia group of ALIA has an online journal club which works on a wiki platform. If you're interested in joining, go to that URL on the screen there, which is the HLA page on the ALIA website, and there's some more information including how to request access. So you just send in a request and then you'll be given access to the wiki. So the Journal Club members vote. They're given about 4 or 5 options and they vote on which paper they want to discuss. And then we discuss the paper online for about a month. So everybody just logs in when they can to follow the discussion and contribute as they like. And the discussion is broken down into elements. So we look at the methodology, we look at the results, we look at critical appraisal. And then a volunteer will write up the discussion as an evidence summary, and that's published in the next issue of Health Libraries Australia News. So that's brings me to the end of the section on critical appraisal, and now I'll hand back to Jill to wrap it all up.
To wrap it all up, indeed, yes. Well, thank you. It's been, I think, the sequencing of the activities and the program across the various weeks of the course have, I hope, sort of scaffolded your understanding and developed your skills and expertise and understanding across the different areas. And obviously, critical appraisal is much more at the pointy end than where we began a couple of months ago. So hopefully you found it valuable to sort of work through that progression. And obviously we're delighted to have so many fantastic health librarians join us and contribute to the program. So what we want to do from here is actually to have some fun, but to do that in a serious way. So the fun bit, there's again a video. We will save time now and not watch it, but please go and watch this. It's a really good spoof on the whole evidence-based environment and critical appraisal and things like that. So go and take a look at that. There's a link on the Blackboard site as well, but hopefully you can see that even rigorous health professionals can think outside the box and have some fun at different times as well. So go and have a look at that. And then the serious side is, for those of you who are sticking with us beyond week 8, there is the assignment to do, which is directly relevant to everything you've heard tonight, and developing your own evidence summary. So we didn't update this one, we haven't got the date in there. What you're required to do for assignment 3, there's 2 research articles, and what we hope you can achieve is to critically appraise both of them and develop your own evidence summary for each. So we're really trying to help you develop those skills. As we've talked about this evening as well, don't feel that you're alone. Feel free to do it in pairs and to work through the questioning approach that you need to get yourself involved in. You'll find that quite helpful. All the details of the different articles, etc., and the process, the actual activities you want you to do and how to present it, that's in the assignment briefs document. The due date, which is not there, is the 22nd of May. Thank you, and Cecily's been dropping in there with all the valuable information there. So that's another 3.5 weeks away or something like that. So make the most of that time. I really, even if you're not doing all of the assessment, the transferability of the critical appraisal process across the different disciplines. So you'll find with this, one of the articles that you're doing an appraisal for is in the health sector, and the other is in the library sector. So that transferability of ideas, the value of being able to think critically and to look at research materials with that sort of skeptical eye to sort of really consider how well the work has been done. I'd encourage you to really do that. So even if you don't submit it for assessment, take some time and work through it and develop your skills. The research articles, Mary Simons, you met quite a few weeks ago. She has an article, and it's about rethinking the role of the library in the clinical environment. The reference is there. And for that one, we need you to use the Reliant Critical Appraisal Checklist. And that's come out of the EBLIP arena. So from Denise Kuvajaniatis, however you say her name, she has developed some work in that area. The second one, we're back in the health sector properly for this one, and it's around sort of a randomized control trial to do with the effect of swimming on ear problems in Aboriginal children. And for that, the CAS critical appraisal tool is what we'd like you to use for that. Okay, so 2 different skill sets involved there. Interestingly, and just very recently, there was an article which actually did a systematic review of evidence that swimming pools improve health and well-being in remote Aboriginal communities. So that's a bit of further reading for you, and that will obviously give you some idea about some of the ideas or the methods that are presented in the research and everything. So you've got a bit of background reading. Yes, let me just go on for a minute. Hold on. So Blackboard's your go-to place, of course. The articles, the appraisal tools, they're all available on Blackboard. And there's a template for evidence summaries as well that you can use along those lines too. For some examples, in terms of modelling it, there's, as Suzanne has just mentioned, evidence summaries are published in the EBLIP journal, and we've made some of these available to you on the Blackboard site. When we were developing the course, I got in touch with the EBLIP editorial team and asked them to nominate a selection of evidence summaries that they felt were really high quality. And the ones that they singled out are the ones that we've actually put onto the Blackboard site. So they've been peer-reviewed, if you like, beyond the normal peer review process, and they're felt to be of high quality. So you better learn from, much better to learn from good quality. Because even though they're published, there's still a sort of, I suppose, a learning curve to go through in presenting evidence summaries. The evidence summaries that are published in EBLIP are peer-reviewed. They're not just randomly published, so to speak. So they also go through that review process to look at the quality, so they're critically appraised, the evidence summaries themselves are critically appraised. So learn from some of those examples and identify the attributes that you think are really quite good and that you'd like to adopt in doing your own evidence summaries. So that, as I say, is by the 22nd of May, ages away yet. Gosh, and I think what I've got to achieve by the 22nd of May, haha, but I'm sure you're all very busy too. So from here, obviously we'd like to thank you. Sorry, Robin's got a question before we go there. Do we submit our critical appraisals and our evidence summaries? The assignment activities, if you are submitting it for assessment, yes, that's the actual assignment work. But what I was trying to say was, even if you're not submitting assessment, try to develop your skills in that area. The value of doing it for the assessment is that you get that formative and feedback on the work and some guidance about how you might do it slightly better, or to get, sort of found that you're really on the right track and you're doing it very well already. So feedback is always welcome. So if you'd like to do it that way. But yes, you do submit it using Blackboard as usual, and I think that should be fairly straightforward. But read the assignment briefs for all the details. So from here, it is the end of the classroom sessions. Obviously, the recordings are all there for you to go back in. It has been fast and furious, and so make the most of the opportunity to revisit areas that you think of and you'd like to learn a bit more about. The resources that we've put heaps on the Blackboard site, you've got access, I think, till the end of June. So make sure that you don't get cut off. Make sure you use the QUT access rights to explore different resources. So that's all very good. Upcoming events that you need to think about to take your career further. If you're in the Sydney area or can find the excuse to drop down there, HLA have got their Professional Development Day, and that's on the 18th of July. So try to make that. You can meet some of these virtual people in reality. They'll all be there. And as we've already talked about, and hold on, there's a question there, but I'll just finish this bit first. The Evidence-Based Practice Librarians Institute that we've talked about is in Adelaide over that period of the 5th to the 9th of December. So go to the LibGuide to get further details. So the assignment task says that the appraisal should be written up in your evidence summary. So yeah, so that what you're submitting is the evidence summary. That's the deliverable, if you like. So you undertake the task, all those sort of looking at the questions, but then you write your work up as an evidence summary. But Suzanne's dropping in with some words of wisdom. Exactly. So use the critical appraisal tools to help you write the evidence summary. So you can't really do the evidence summary without systematically, to use Suzanne's word from the opening of this session, systematically working through the type of questions that you do need to consider, the quality of the research, the methodology, where there might be some shortcomings and things like that. So that's the avenue to go with that. And recognition of the course. There will be certificates of attendance. That's all organised at the QUT end. It does take a few weeks as the CPD people are responsible for that, and there's obviously the assessment to get finalised. If you have completed all of the assessment, then we send out to you a formal letter which gives you the marks you've achieved, the final grade and the course outline, so that you can use that to approach other universities or QUT if you're enrolled here to get recognition for an elective subject. Most of the universities, I think, are on board, understanding the value of this program and do recognise it, but you have to negotiate, submit that locally. Kate's dropping in to clarify things here. You get a certificate of completion if you do the assessment, and a certificate of participation if you've just dropped in and listened and not completed the assessment activities. So there's lots of great feedback coming through. We do send out a survey to get your feedback about the program, of what's worked and what hasn't worked, and what else you'd like to see included in the program. So please make the time to contribute to that. As I say, there's lots of different ways that you should and could stay in touch. If you haven't yet become a member of ALIA HLA, please do that. As you can see, the course is totally underpinned by the expertise and the knowledge from our professional colleagues in that area. If you've been involved with some of the mentors, make sure that you continue with that. There are avenues. You have the email addresses for the presenters. They'd be delighted to hear from you. But also, if you can make it to the HLA day, etc., lots and lots of things. And yeah, with each other. The Facebook site's still there, and it hasn't been a terribly active one, but there's been a bit of communication. But those of you, especially in the larger organisations like La Trobe, who've had 8 participants, make sure that you do things, and then keep in touch with QUT. There's lots of social media avenues that the library program offers at QUT, so to keep in touch, and I'm sure watch for other courses that you might like to join in on. And everybody says Wednesday evenings won't be the same. So thanks to you all. Keep in touch. It's not over for most of you that are completing assessment, but bouquets to everybody for what has been, I think, a good program. And as I say, we look forward to hearing more. Thanks to Kate for being in the background and making sure it's worked. So it's been wonderful to have you on board, and I hope to meet you in person in different places as well. So over and out from me, and